Hi, my name is Ewoma Ogbaudu, and I'm a first-generation immigrant from Nigeria. I'm a third-year medical student at the Mayo Clinic Alex School of Medicine, and this is my elevated story. Growing up as a Nigerian immigrant, I felt like there were really three things that I could become, three things I could pursue as a career, and that was becoming a doctor, a lawyer, or an engineer. And because I had great grades and I was the first valedictorian from my high school, I was kind of pushed into this path of pursuing medicine and becoming a doctor. But when I got to college, I realized there was so much more out there than just those three. And I discovered a love for photography and wanted to kind of pursue something in the arts or pursue something in business because there were so many other opportunities. But while I was taking a public health course in my freshman year, we took a walk through the Upper East Side in New York City, which is relatively affluent, and East Harlem, which is definitely not so. And I started to notice so many differences between these neighborhoods. In the Upper East Side, I saw people pushing their poodles and strollers, and I saw finely manicured grass. Whereas in East Harlem, I saw playgrounds held together by duct tape and prayers. And that really sparked something in me to say that, hey, there's so much more that I can do to impact people from communities like where I'm from, uh, and really make a difference in their health and their health outcomes. And that's ultimately why I decided to pursue a career in medicine. It definitely came as a bit of a sticker shock when I found out that medical school on average costs people $200,000, and that's how much they're taking out in loans. When I come from a family where neither of my parents have made over $40,000 in a single year. And it definitely made me rethink things for a second to try to figure out how to finance things. And I've been fortunate to meet a wonderful woman who's now my fiance, but she's also the first in her family to go to medical school. So together we've been trying to really navigate the financial landscape of medicine as far as what does this mean for both of us now moving forward? How much are we both taking out in loans to support our education? But in being the first in my family to go to medical school, I've been figuring a lot of it out on my own. I don't really have many mentors or people who have gone this path before me where I can ask them, hey, how did you do this? How can I pay for this? How can I finance that? So that's been a struggle in and of itself, on top of all my studies. If I were to describe my medical journey in a short phrase, I'd say that it's been twice as hard. Growing up, my dad always told us that we had to work twice as hard to make up for the privilege that we didn't have, the privilege that our classmates from more affluent backgrounds had, and people who had generations of family members going through the medical process before them. And I've really seen that in my medical school and in my classes where I'm figuring out things on my own, whereas other people have a playbook that they can follow. Even when I was taking the MCAT, I was figuring out how I should study for it, how I should balance that with my classwork and so many other things. And I actually ended up taking my MCAT twice because I didn't do well the first time around. Whereas other people had the resources to pay for the money to pay for the study resources, and they also knew which resources to get. Whereas I didn't know a lot of these things. Being an ElevateMeD Scholar is unreal. You know, I still remember volunteering just last year at the Explosion of a Dream event and getting to talk with the current scholars about what this scholarship program was all about, not just about the financial resources, but everything else that came with it, the leadership development, the courses on money management, and so much more. And then the larger network that it really, the larger support network that it plugged them in with, not just physician mentors, but also peer-to-peer mentors. And that's what really excites me about being in this program. I think leadership development is huge, and that's not something that is really taught in medical school. As physicians, we're going to be expected to lead teams and to uh, be able to delegate responsibilities and really do so much more. And I'm excited to have the opportunity to learn more about what that's all about and to really develop my skills so that I'm the best version of myself each and every day when I'm in clinic for my hospital care team and for my patients as well.